Good day, New York Foundling employees. This presentation was put together for you in case you were not able to attend one of the open enrollment meetings. During this presentation, we will be covering your employee benefits program, and we're going to start off with this first slide that says important information for all employees of the New York Foundling Hospital. The first part just goes over your eligibility, and it states that new employees are eligible for benefits the first day of the month following 60 days of full-time employment. Only employees working at least 30 hours per week will be eligible. Employees that are labeled as part-time, per diem, or temporary employees might be considered variable hour employees. And what this means is that for 1 year, New York Foundling Hospital will be tracking your hours, and if at the end of that 1 year you end up averaging at least 30 hours per week, you will qualify for the benefits. So again, this is your open enrollment period, and what that means is that this is the time frame in which you have to elect a plan. You will have 2 medical plans to choose from and 3 dental plans to choose from. This is the time to make any sort of change. If you do not make any changes, you will not be able to do so off cycle. The only time you can make a change is during your open enrollment period, or if you have a qualifying event, and your qualifying events are bulleted right there. So you'll notice divorce, change in employer contribution, separation, loss of dependent status, and so on. Just to give you an example, let's say today you're on your spouse's plan and your spouse loses coverage through their company. Well, in that circumstance, you and your spouse would qualify for the New York Foundling Hospital plan. Another example, let's say you have a baby, then you can add that baby to the plan. However, any change that occurs must be notified to HR within 30 days of the qualifying event. The second page goes over COBRA and dependent eligibility. If you are terminated, you are eligible for benefits through the New York Foundling for an additional 36 months. However, if this occurs, you will be responsible for up to 102% of the premium. So today, what comes out of your paycheck is only a fraction of the cost because the New York Foundling Hospital pays for a huge percentage of the premium. Well, if you go on COBRA or if your dependent goes on COBRA, they will be responsible for 102%. Your dependents are eligible to stay on your medical plan up until the age of 26. This slide is a very important one. This goes over your contact information. So at the very top, you'll notice that the difference card's phone number is listed there. The difference card is a vendor that has partnered up with the New York Foundling Hospital, and they provide a debit card that helps offset some of your member responsibility when you go to the doctor or you get drugs or you go to the hospital. They have set up a fund that is an account that is funded by the New York Foundling Hospital, and they help subsidize these medical expenses. Right below that, you will find Oxford Liberty's contact information. Oxford Liberty is the insurance carrier that will be providing you with medical insurance. You will find their number and their website as well, and this is useful in the event that you want to find out if the doctor participates or if your claim has been processed, and other useful medical information. In addition, you will find Guardian's contact information. Guardian is your dental carrier, and they will be able to provide you with the same information that the Oxford website will give you access to. And most importantly, you will find the Medical Links contact information at the bottom of the page. We are not employees of any one of these insurance companies. We are actually the health insurance broker that works with your executive management team and worked very closely with them in launching your benefits program. So if there is ever a time that you need assistance with obtaining prior authorization or finding out why you owe so much money for a medical bill or finding out if a doctor participates, we are always available to assist you and hopefully expedite the process. This slide is a high-level overview of what your medical program looks like. Before we dive into the benefits, I'll just give you a very general overview of your network. You will notice that both plans utilize the Oxford Liberty Network. It is referred to as the Oxford Liberty Network in the tri-state area. Nationally, you will be using the United Healthcare Choice Plus network. The one thing that's important to note here is many of you were on the HIP plan last year, and as you can tell, that plan is no longer available to you. If you were on the HIP plan last year, you will automatically be rolled into the Oxford base plan. If you would like to move to the Oxford BIA plan, you will have to complete a form and submit it to your HR team. Just to give you some background information, HIP is a community-rated health plan, and what that means is that your rates are based on the community, not on New York Foundlings Health, whereas with Oxford, you are experience rated, which means that the insurance company will look at the experience and the health status of your organization in determining next year's healthcare costs. So it is incredibly important that everybody participates in the wellness program. Not only will it help keep health insurance costs down, and the New York Foundling will be able to provide you with rich benefits, it also allows you to utilize the difference card benefit. I'm going to skip over the deductibles here, and I'm just going to jump to the copays because those are a little bit more simple. So you will notice that your office copay, where it says PCP, that stands for Primary Care Physician, there is a $30 copay. Now, again, the figures indicated in the parentheses, those reflect what the member responsibility is if they complete the wellness program. And if you do complete the wellness program, then that is where the difference card will come into play. Your specialist copay, $50. Again, if you participate in the wellness program, you will only have a responsibility of $20. And one difference from last year's HIP plan is you will notice that if you are seeing a specialist, you do not need a referral. So at the very top where it says PCP referral, not required, this means if you are going to a specialist, let's say you wake up tomorrow and you want to go to the dermatologist, you do not need a primary care physician referral. I will jump down about 2/3 down the page. You will notice RX generic, RX brand, and RX non-formulary. These are your drugs. Now, Oxford does it a little bit differently than HIP and some of the other insurance carriers. They refer to they band their drugs in tiers. So generic is tier 1, brand name is tier 2, and non-formulary is tier 3. Generic drugs are $15, brand name drugs are $35, and non-formulary are $75. The one thing that's important to notice is right below that you will notice RX deductible. This is different from the deductible at the top of the page. This is your drug deductible, and the only drugs that are subject to this deductible are tier 2 and tier 3 drugs, so brand name and non-formulary. And what this means is before you start paying those copays, you must first pay $250 worth of drugs before you pay the $35 copay. So if a drug costs $80 and it's a tier 2 drug, you will have to pay the full $80 until you've paid a total of $250. Once you've paid the $250, then you'll pay the $35 copay for that tier 2 drug. Again, if you participate in the wellness program, you will notice that the member responsibility is $100 instead of $250. Generic drugs are not subject to the deductible, so you will always pay $15 for generic drugs, regardless of whether you have satisfied the deductible. At the top, you will notice individual deductible, $2,500. And what this means is if you are hospitalized or you have any sort of major service, you will be responsible for the first $2,500. Again, this is only for major diagnostic hospital work. For your doctor visits and drugs, again, you pay copays. For emergency room, you pay a $500 copay. But for hospital visits, you pay the first $2,500. I will skip over the buy-up plan and I'll review it on the second slide. So again, this goes over the difference card benefit, and it shows you the difference in benefit contingent on whether you participate or do not participate. So the first column goes over what the service is. The second column shows what the employee pays if the employee participates. The third column shows what the difference card pays, and then the very last column shows what the Oxford benefit is. So you will notice for a primary care visit, the Oxford benefit is $30. If you participate in the wellness program, the difference card will pay the full $30. So you will get a debit card, and you will be able to swipe that debit card at the doctor's office for the full $30. The specialist benefit with Oxford is $50. Again, if you participate in the wellness program, when you go to the specialist, you will swipe your debit card for $30, and you will have to pay the balance. Now again, the card is smart, so if you are at the specialist's office and you try to swipe the card for the full $50, it will be declined. So you must swipe it for $30 and pay the balance in cash or with your other MasterCard or whatever your means of payment is. Emergency room copay is $500. If you complete the wellness program, you will pay $250, and the difference card will pay $250. Prescription drugs, Oxford benefit is $250. Difference card pays $150. You will be responsible for $100. So for all of these services, you will be able to swipe the MasterCard that you get from the difference card. However, for hospital visits, you will not be able to swipe the card. You will actually have to submit a manual reimbursement. So you will notice the Oxford benefit is $2,500. The difference card will cover half of that, and you will cover half of that. So what we strongly encourage members to do when they go to the hospital, and after you've had your visit and you're leaving, typically the receptionist or the front desk person will ask you how you would like to pay for the bill. We highly encourage that you ask the bill is sent to your house instead of paying it right there, because usually the hospital is just trying to collect the money and they don't care if it's coming from you or from the insurance company or from the difference card. A lot of the times they don't even know how your benefits program works. So let it do its due process. Let the hospital send the bill to the insurance company. Wait for the explanation of benefits, and this goes over what you owe and what the insurance company covers. And then you will send that explanation of benefits to the difference card so they can process. At the bottom, you will notice the benefits that you will receive if you do not participate in the difference card program. So you will notice that the difference card pays pretty much nothing if you do not successfully complete the wellness program. The only thing they will cover is your in-network coinsurance. And we have not discussed this, but if you flip back to the other slide, you will notice that coinsurance is 40%. And what this means, after you have satisfied your $2,500 deductible, you are responsible for 40% of hospital bills. Well, the New York Foundling is kind enough to cover that 40% regardless of whether you participate or you don't participate. However, if you do not participate, you will be responsible for the full $2,500 deductible. This page highlights your buy-up option. You will notice the only difference between the buy-up option and the base option is the in-network deductible. So I will quickly flip back to this page. You will notice the deductible on the base plan is $2,500, whereas the deductible on the buy-up plan is $1,000. However, the New York Foundling will not fund any of that $1,000 if you elect the buy-up plan. What that means is the difference card will not be available to you for that $1,000. Whereas on the base plan, they fund half of the $2,500. So you will notice the member responsibility of $1,250 on the base plan is only $250 more than the $1,000 on the buy-up plan. Again, these are the difference card benefits on the buy-up plan. You will notice that your benefits for all the other services are richer on the base plan. So on the buy-up plan, your primary care copay is $15 and the difference card pays $15. Whereas on the base plan, you pay $0. Your specialist copay is $35, whereas on the base plan, it was $20. Your prescription deductible is $250, whereas on the base plan, it was $100. So you may ask yourself, why are we offering this buy-up plan when the base plan seems to be better on some of the other benefits? And it's really a technicalities issue. Oxford has mandated that we offer two plans in order to be able to offer these types of benefits. I won't go over this page line by line, only because I gave you a high-level overview, but these are instructions for using the difference card. So you will notice that in-network primary care visits and specialist visits, you can swipe your card. You'll notice that you can swipe your card at the emergency room. However, it does detail what you have to do once you receive a bill at the hospital. So please do read all of these line items, as they will give you a better understanding of how the difference card benefit works. This slide highlights what you need to complete in order to qualify for the wellness program and those nice, richer benefits. You will notice that you need to earn 50 points in order to receive the benefit. And on the right side, you'll see how much each service equates to, or what you can do to accumulate those 50 points. Under both Oxford plans, an annual wellness visit is free, and that is the law now, so your doctor will not charge you. And you will notice that a physical exam satisfies the full 50 points. And then if you read line by line, you'll notice that there are other points that qualify, such as online health classes, on-site health education, on-site health screenings, and physical activity incentives. I'll quickly fly through the dental program. It's the exact same dental program that was available to you last year. It will still be offered to you through the Guardian. You will have a triple plan offering. Two of the offerings provide you with out-of-network coverage. You will notice that the plan on the far right only provides you with in-network coverage. So you must go to a DHMO provider, and they must participate with the Guardian DHMO program. You will notice that you pay a copay for each service. That is a fixed dollar amount that you will always pay if you have that service rendered. With the PPO plan, you pay a percentage of the bill. The percentages are broken up into 3 tiers. So you have preventative services, which you will notice there's no charge for. Your basic services, you are responsible for 20%. And your major services, you are responsible for 50%. The biggest difference between the two PPO plans is that the plan on the far left has a maximum benefit of $8,000, and the plan in the middle has a maximum benefit of $2,000. What this means is once Guardian has reimbursed either $1,000 or $2,000 worth of bills, they will stop reimbursing you. So, for example, let's say you have a porcelain crown, and you will notice that the benefit is 50%. Well, if that porcelain crown costs you $3,000, which is very unlikely, but let's just use that number anyways, 50% of that would be $1,500. Well, your maximum benefit is $1,000, so you would actually have to pay $2,000. But one thing I forgot to discuss is at the very bottom, you will notice the premium for a single and a family, and you will notice that the cost has gone down. So while we've been able to retain the same quality of benefit, the cost that is coming out of your paycheck is actually less than last year. And these are monthly premiums. So you are paid biweekly, so it's about half of what you see there. This is the cost to your health plan. So you'll notice on the left side, salary bands under $20,000, $20,000 to $30,000, $30,000 to $40,000, and so forth. The way the New York Foundling charges their employees is it is reflected in an inverse relationship. So the more you make, the more you will contribute towards your health plan. You will notice the base plan has 4 tiers. So just starting with the top right corner where it says earning under $20,000, the individual will pay $21.55 biweekly. Employee spouse is $45.26. Employee and child is $37.72. And family is $65.73. And then you will notice the more you make, the more you contribute. In addition, you will find the premiums associated with the buy-up plan. So you will notice that the cost to the member is slightly more with the buy-up plan than it is with the base plan. If you are a new employee, you will have to complete this member enrollment form. If you have any questions on the enrollment form, you can always reach out to the medical link and we will walk you through the process. If you are an existing Oxford employee and you want to enroll into the base plan, you will have to complete this form. Or if you want to add a dependent or take a dependent off, you will have to complete this form. This is your Oxford Edition termination change form. Again, if you need assistance with completing this, you can always reach out to somebody from the medical link. This is your Guardian enrollment form. Again, if you are a new employee and you would like to join the dental program, or if you just would like to join because you're not on the dental plan today, this is the form you will have to complete. An additional perk you receive as a Guardian Dental member is you will have vision discounts available to you through Guardian VSP. Please keep in mind this is not a full vision program. It is just a discount program. So you'll notice that you get a certain percentage off certain hardware and eye exams as long as you go to a VSP provider. A similar benefit is available to you through Oxford. So you will notice that Oxford uses the General Vision Services Plan. And in order to activate this program, you will have to call the number in the bottom right-hand corner. You provide them with your Social Security number, and that will also be your member ID number when you go to a GVS provider. On this page, you will find the discounts that are available to you. Again, you'll notice you have discounts for frames, lenses, contact lenses, eye exams, and some other vision services. Again, this is not a full vision plan. It is a vision discount plan that is available to you only if you are on the Oxford medical plan. Okay, we are almost done. The last two programs are fun programs, so I hope you've made it through this presentation thus far. This is the gym reimbursement program. If you belong to a gym and you go at least 50 times per 6 months, that's about twice a week, you and your spouse will qualify for some sort of reimbursement. Members qualify for a $200 reimbursement and spouses qualify for a $100 reimbursement in 6 months, so that's a total of $300 per 6 months. Again, you are required to go at least 50 times per 6 months, and the gym must have 2 cardiovascular types of machines. So just to give you a sense of what that is, a treadmill and an elliptical will qualify. Most gyms today do have those types of machines. The one thing you are required to do is keep a log sheet that validates that you went at least 50 times. So again, you can have a manual log sheet and somebody from the facility can sign it. Most gyms today are smart gyms, so you have a scanner and they can just print out a log sheet for you. The last program that's available to you if you are on the Guardian Dental plan is the College Tuition Reimbursement Program. Again, I'll give you a high-level overview. So in a nutshell, if you have any children, nieces, grandchildren, you can enroll them into this program. And the way the program works is every year the member will qualify for up to 2,000 points. And each point is equal to $1. And at the end of their junior year, so once they are 17 years old, they will accumulate points, and however many points they have accumulated, they will be able to convert to dollars and apply towards tuition at any one of these participating colleges. So again, let's say somebody signs on when they're 12 years old. By the time they're 17, they will have been on the program for 5 years. That's 10,000 points, which equals $10,000. And they can use that $10,000 towards any one of these colleges. Again, if anybody has any questions, they can always refer to this contact sheet. Again, the Medical Links contact information is at the bottom, and you are welcome to reach out if you have any questions.